feel the pain, I know, down into your neck and all that stuff, but can you show me where you're feeling the pain?
Right here. The muscle right here.
Okay. Okay. So right through here?
Yeah.
Tell me where else you feel it. You feel it down into your arm, I know that. Into your pinky finger, right?
Yeah.
Do you feel that right now?
Yeah, a little bit.
Numb right now?
Yeah.
Okay. And then right now you feel some neck pain too, right? Where do you feel the neck pain right now?
On this side, a little bit, but mostly right here, down up here to up here.
Oh yeah, you said you feel numb here.
Yeah, a little bit. Once in a while.
Numb?
Yeah.
Right here?
Yeah.
That's interesting, okay. How long has this been going on?
Like 6 months.
6 months of the numbness? Okay. But you said it started with your hand, right? And then it went up to there?
Yeah.
Okay. And the neck pain you've had for a year, you said?
Yeah.
And then you said you also feel some pain over here too, right?
Yeah.
Where else are you feeling problems right now? Because I'm looking at your back, I can see. You said some...
That's, yeah, right here.
Right there? Okay.
Yeah, weird pain right here. Yeah, sometimes I get numb around here, this part.
Numb?
Yeah, a little bit.
So here, what you're feeling over here is the AC joint. So this is a lot more prominent than this joint. So usually when it's over there, there's some sort of separation in the AC joint, okay, where this is actually popped out more than this one. Okay, so I don't know if you noticed, it's much more bony over here than this one.
Yeah, I know.
You have noticed that?
Yeah.
Okay, yeah. So that's actually, this is separated upwards. And the AC joint has actually separated that this way. Standing equally, but then if we start going up, we see a torquing effect all the way into the skull. Your whole head is twisted this way, even though you're trying to look straight. Yeah, so we gotta work on that too. We're seeing some swelling over here. We see that horizon sign. We see posturally you're off that way. Okay, so first thing I'm gonna do is just scan you with this and see what's going on. Okay, so something going on over there. Okay, right there. Okay. Is that painful right there?
Yeah.
Yeah? Okay. Just a little swollen over there, but let's see what's going on up here. So, painful here, right? Tender? Not too bad here, right? And then over in your neck you feel it here, right?
Yeah.
Okay. That one's not moving very well. Is that tender here?
No.
Okay. It hurts over there?
Yeah.
Okay. What I'm going to do work on is over here, your C6, to help with some of that neck pain, but then I'm also going to work here to help with some of that nerve pain that you're feeling over there. And I have a quick question. Does that bother you?
No.
Okay, just relax your shoulder. Okay. And tilt your head in that way. Do you feel it at all? Into your pinky? Not too much?
Not too much.
Okay. Okay. So we're going to work on C6, T4, and we're also going to work on your L5, okay? We're going to get it from this side, okay? Just relax. There we go. I'm going to give this a little push, and so just relax you. Oh, good. Not too bad, right? Good. Okay. This is your T4. This does go down into your ulnar nerve, so I'm going to have you just relax your belly a little bit more. I'm going to give this a little push. Good. Okay. And then I'm going to just make sure it's good on the sides. Okay. So just relax a little bit more. Good. Good. Good adjustments. Okay. How was that?
Feel light. I feel lighter now.
Good. Feel lighter. Good. So I want to check some of the swelling that's happening over here. But sit down one more time for me. I just want to check. So move your neck around. See if that feels any different.
A little bit better.
Yeah?
Yeah.
Where?
On this side.
Okay.
And this one a little bit better.
Yeah. Okay. Oh, over here is better.
Yeah.
Okay, good. How's the numbness done into your pinky?
Okay, a little bit, but a little bit better though. A little bit lighter on this side.
Good, man.
Yeah.
We got a couple more to go, okay? So I know this is feeling better, but I just want to feel a couple things. Just relax. I know it feels better, so I'm just going to be a little light with it, okay? So just relax here. So we're going to give this a little push, okay? So just have you just relax here. A little bit more. Good. Ooh, good one. Okay. So it's a little less prominent in here. Not a little less, it is less prominent into there. So good. So you said you feel it like here? Yeah. Okay. Good. Okay. Move your elbow around a little bit. Not too bad, right? Yeah. So I'm going to tell you, just looking at you, the shoulders are better into there. So this side is already less prominent than this side, but we didn't tape it yet, so you just have to be careful with like lifting really heavy things into there. You have what's called a horizon sign, so that's basically when it separates out like that. So you know this is more prominent on this side, but we might need to tape it or do something else later with it too. But I'm gonna just try to make sure it feels better in general. It should feel better like after those adjustments, and you can move your arm around just to make sure.
It's still a little bit though.
Okay.
Yeah.
Different though?
Yeah. Lighter.
Lighter?
Yeah.
Okay. Don't do anything that's really heavy with that because that'll pull that separation down. Yeah. So try to use the other arm. You're probably a right-hander, right?
Yeah.
Yeah.
I've been using this whole arm for a while.
Okay.
I know that. I don't know. I have rested this arm a lot.
Okay. Leave that alone for a little bit, and I want to see how that does without you doing too much with that arm. Okay. Yeah. And then just keep in mind, take your activities just in general a lot easier. Okay. I want to really fix the root cause, but if we're doing that, sometimes it can be a little sore. Okay. So just be aware of that. All right, Tom.
Bye.
Yeah.